Thanks again, everyone, for joining us here this morning. 3 weeks ago, Logan and Kayla invited us into their home to tell us their story. And I want to say thank you to them for inviting us back here again today. Kayla was recently diagnosed with stage 3 breast cancer. And she was given a horrible choice. She could either wait until February of 2025 to be able to get the tests that she needed here in Saskatchewan to confirm her diagnosis, or the choice to travel to Alberta to get results faster and to begin her treatment. Let's be clear, no one should have to make that choice. What Kayla and Logan have been through is heartbreaking, and unfortunately it's something that we hear all too often in this province. Our healthcare system is broken. Long delays for tests, for surgeries, overrun emergency rooms, and the list goes on and grows. Last week, Scott Moe said that he was going to focus on what's working in healthcare. The problem is that almost nothing is working in our healthcare system right now. Over the weekend, he released a platform that doesn't invest a single new dollar into our hospitals or clinics. When you factor in inflation and population growth, what that means is cuts to our healthcare system. Let's look at the reality in our healthcare system in Saskatchewan today. Last year, more than 4,000 professionals left the healthcare workforce in Saskatchewan, and that's at a rate higher than any other province. This has led to emergency room closures, service blackouts, and in the most severe cases, instances of patients dying in our province before they get the care that they need. This simply has to stop. People in Saskatchewan, like Kayla and Logan, on top of devastating news, should not have to endure the additional stress and suffering, especially at such a terrible moment in their lives. And that's why I'm here today to commit to change, to getting to work on day one to end our healthcare crisis in this province. And that has to start with people on the front lines in our hospitals and our clinics. I'm here today to announce that an NDP government will reduce the workforce turnover by half. We'll hire an additional 800 frontline workers into positions in the healthcare system where they're going to have the greatest impact. And we'll start by listening to the concerns, but also the solutions that Saskatchewan healthcare professionals have been putting forward for years. Solutions that have gone unheard by the Sask Party government. We're also going to end the culture of fear amongst healthcare workers. We're going to take steps to prevent worker burnout in this province, to ensure safe staffing levels, that they have the tools that they need, and improve both working conditions and healthcare for Saskatchewan people. We'll bring frontline voices to the table as we tackle the healthcare challenges that we see in this province. We'll also recruit, train, and hire more healthcare workers with our Grow Your Own strategy. What this will lead to in our province is literally thousands of more frontline nurses and doctors and other in-demand professionals to ensure that our hospitals are ready for people to receive the care that they desperately need. And we're going to take care of healthcare workers so that they can take care of us. And to the frontline staff in this province right now who are working without the tools, without the supports, working short, working overtime again, I want you all to know that help is on the way. Now, over the weekend, many of you may know that a memo was leaked to us detailing several serious medical blackouts right here in this city, in Regina. These blackouts have the potential to be life-threatening, and they were caused by a physician shortage. I'm committed to working with those physicians, those on the front lines, to prevent blackouts like this from happening in our province. It's simply time to get healthcare out of last place. We'll ensure that people living here, people like Kayla, can get the care that they need when they need it, without having to leave the province or pay out of pocket to get it. And on October the 28th, Saskatchewan people can vote for better healthcare. They can vote for change. And say thank you, and I want to turn it over to Kayla to tell her story.
Okay, thank you so much. My name is Kayla Deeks. I'm a hairstylist and a local business owner here in Regina. I'm 35 and was recently diagnosed with stage 3 breast cancer. In December 2023, I noticed a breast lump. I was immediately concerned, so I made a doctor's appointment the next day. A mammogram and ultrasound was scheduled, and the next available appointment in Regina was 3 months away. I wasn't going to wait 3 months because I was told my whole life discovering a lump is very serious, so I fought for a sooner appointment. Apparently, this meant I had to leave the city. I had an ultrasound and mammogram in Moose Jaw and was told a follow-up appointment was necessary. My next appointment was also out of the city, and that's when I was told things looked concerning, so a biopsy was ordered. I was expecting a biopsy during the concerning ultrasound, like my grandma and my best friend had experienced years ago. Instead, mine was scheduled for February 2025. February 2025. I would still not be diagnosed today. Knowing a breast lump is very serious, I had to fight yet again for a sooner appointment and was finally sent to Calgary this past July. At the private clinic in Calgary, I was told I had cancer right then and there. I was so scared, but I felt like I would finally be taken seriously after being brushed off countless times by the Saskatchewan healthcare system. Instead of being at home, I was left recovering from a painful procedure in a hotel room. I had to call my loved ones and tell them that I had cancer over the phone, almost 1,000 kilometers away from them, left to deal with this horrible news with no support. Even though I received the worst news of my life, I'm so grateful that I was able to afford to take the time off work and pay my way to Calgary for this diagnosis, because I had to pay $2,000 out of my own pocket. In July 2024, I was diagnosed with an aggressive form of breast cancer that is now in stage 3. Because of the delay, my cancer has also spread to my lymph. If I would have trusted the Saskatchewan healthcare system and waited until 2025 for my original biopsy in Regina, I'll be frank in saying this, I wouldn't be alive to make that appointment. And this is not how healthcare should be. You shouldn't have to leave the province you pay taxes in for simple medical care. It's hard enough to deal with a diagnosis like cancer, but I quickly became aware that fighting for my literal life meant fighting the Saskatchewan healthcare system as well. I'm a firm believer the only reason the healthcare system is working at all is because of the doctors and nurses themselves. Those who have chosen to stay in Saskatchewan are giving countless hours of their own time and effort to make it work. My oncology appointments have been as late as almost 3 hours and at 8 p.m. at night because my oncologist has a huge heart and gives his own time to help his overcrowded patient list. Saskatchewan can't afford to lose an incredible specialist like him, but we will. If things don't change, all of these incredible healthcare workers will continue to leave. My body picked an absolute terrible time in Saskatchewan to get cancer. It shouldn't be based on timing. I should be able to trust the healthcare system and only focus on getting better instead of fighting for care. 1 in 8 women are diagnosed with breast cancer. If things don't change, I would encourage women I care about, like my niece, to leave this amazing province so they don't become another healthcare statistic like I was so close to being. Thank you. Thanks.
We'll take questions.
Yeah, we'll take questions.
Carla, just your plan that these 800 workers, just who are these workers? And yeah, can you maybe just elaborate more on what that looks like?
Right. There are different designations or healthcare professionals that are needed. And what we have committed to is working with those on the front line to ensure that we are hiring those 800 workers into the places where they're most critical to the system right now, where the blocks are, where the blocks to patient flow are in the province. And again, you know, there have been healthcare professionals, nurses, physicians, those who work in radiology, who have been sounding the alarm for years, saying we need to ensure that we're retaining, we're recruiting more professionals here or here. Family doctors, for example, being one of them, rural nurses being another. These are decisions that need to be made with those on the front line in the healthcare system that know where the challenges are, know where those positions are needed most. It's a number one concern. Besides the whole functioning of the healthcare system, is that you have a government in power right now that has simply stubbornly refused to make healthcare decisions with the input of those on the front line. And that is our commitment today, to work with them to ensure that we are hiring people in the places, not that meet targets that you know, bolster a government's talking points, but that actually improve the healthcare system.
And is that over 4 years?
Yes,
Yeah.
the 800 there. And also reducing the loss of healthcare workers. As I said, 4,000 healthcare workers who left the profession, left the province altogether last year, the highest rate of turnover in the entire country. We commit to reducing that number by half. One of the ways that we will do that, right now in this province, even though we have the highest rate of turnover when it comes to healthcare professionals, we do not have a government that is even asking why those healthcare professionals are leaving. They will tell you if you ask them. Some, you know, we've had physicians write letters to the editor on their way out the door to say why they were leaving. But you do not have a government right now that is even showing up to listen to those on the front line, let alone starting to build the solutions to turn those numbers around. Working conditions, safe staffing conditions are two of the main issues that are driving people out of the profession right now.
How are you going to find those healthcare workers? Because every province is looking everywhere it can.
Yeah, no, and that's fair. I mean, there are healthcare recruitment challenges right across the province. The reality is, though, in this province, we are losing more healthcare workers than any other province. I'll give you a couple of examples. In nursing right now in Saskatchewan, we are losing 35 of every 100 nurses by the time they reach age 35. That means we're having a record number of early retirements. One of the things that has been suggested, and again for years, by the nurses in this province is a plan to return those who are perhaps working part-time or casual because of working conditions. I just heard this from a nurse up in Saskatoon last week, that they simply cannot handle working more than part-time right now because of the conditions on the floor. So that's one of them, returning people to full-time positions, improving working conditions so people can be healthy and actually work full-time. Those who have retired early or who have recently retired, those who are willing, coming back into the system to play critical healthcare roles like mentoring new grads, something that's desperately needed right now. We have brand new grads in this province who are working in positions that used to be reserved for those who had a lot of experience. It's an incredibly stressful working condition to be a brand new grad working in places like NICU or an emergency, even more so when you don't have mentorship or receptors or supports. Those are just a few examples of very, very tangible ways that we can retain those healthcare workers in the province. And again, this is not new. The nurses have been asking for this, for example, for years. But their frustration has grown and grown with a government that continues to wave around a 4-point plan, having failed to listen to their very practical solutions in terms of turning around those numbers of loss in the position and the solutions for bringing people back in. The Grow Your Own strategy is another one. Ensuring that those who are already working in healthcare, perhaps people who are already living in communities in this province, have access to the training that they need to either skill up or enter into critical healthcare professions, critical care aides, ensuring that people have the ability to move from an LPN, for example, to an RN position or RN position to a nurse practitioner, to be able to provide primary care, something that is critical in a province right now where 1 in 6 people in this province don't have a family doctor. That was a solution that had been put forth through SARM and SUMA going back years, something that we haven't seen the government move on. Again, and you'll hear me say this often because I understand the stresses that are across the system, and I certainly do not have a magic wand, and every day that we wait, we lose more healthcare workers, the problem gets more difficult to turn around. What we have committed to is that investment of $1.1 billion, implementing the solutions that those on the front lines have been calling for a long time, to getting us to safe staffing conditions so that people can get the care they need when and where they need it. It won't be easy, I understand that, but not working with those on the front line, continuing to hold on to 4-point plans and tired talking points is bringing us to the brink when it comes to our healthcare system in this province right now. This is a critical juncture. This is a critical election. And we need a government that is going to take this challenge seriously and hit the ground running. And that's what we're prepared to do.
Is there any incentive programs that the NDP are considering to help keep nurses and physicians, doctors from moving out of the province for other opportunities?
Yes, I mean we've seen other provinces who again faced with the same challenges have made movement to hire more doctors, to recruit more, to retain more. We've not seen that here. I think we've put forth some very tangible pieces to go that we could hit the ground running with on day one. But we would continue to work with those, again, physicians, those healthcare professionals, to see what we need to do to ensure that Saskatchewan is a place where people want to continue to practice, where Saskatchewan is a desirable place to come and practice. You know, we've had a lot of people who, you know, come to the province, and you know, we have a wonderful province full of opportunity, full of communities where people you know, want to stay if they can, but the working conditions in many of our healthcare facilities, whether it's rural or urban, are forcing people out of the province or out of the profession altogether. Incentives could be part of that. One of the biggest incentives that we can offer, though, is ensuring safe staffing, safe working conditions for those who are in Saskatchewan to practice healthcare, to provide the healthcare that's needed. Until we start improving the conditions in our healthcare system, we're going to continue to see people leave. We saw this up in Prince Albert with when they lost both of their child psychiatrists, for example. There was an incentive to bring a child psychiatrist to Prince Albert. The working conditions meant that physician left the province again in 18 months. Until we stabilize safe staffing levels, until we stabilize the condition in our healthcare system, it's going to continue to be difficult to retain people and attract them to the province.
Do you know specifically what services are being blacked out because of the lack of physicians?
I can answer that one.
You can start. You can.
Sorry, when I saw that list of the things that were getting canceled, my heart broke. I waited 10 weeks to get a port, so I'm healing from it still. A port is something that is installed under your skin so you can receive chemo treatment. Without a port, what you deal with on chemo days are people trying to find your veins that are already wrecked and ravished from chemo. The last one I ended up having had to be in my knuckle. It was the only available spot. And sitting for hours with an IV in your knuckle, it's not okay when you're already going through chemo, you're already going through such a hard time. On that list, there was a bunch of port installations that were gonna be canceled, and that broke my heart. I already waited 10 weeks, and now these people are gonna have to wait longer and longer. And then there was other things as well, but that's the one that stuck out to me the most. My heart broke.
Yeah, we've seen blackouts most recently in Regina with the ports, with radiology.
Yeah. And I believe that radiologists, because when you're sitting for a few hours in the hospital, which I'm in the hospital a lot now, you just hear things. There was a nurse shortage that day, so a bunch of people had to work overtime, and one girl was like, but I'm having dinner with my family. And they were like, can you work? There's no one else. So she had to stay so I could get my port. And that radiologist, he wasn't from here. He was flown in to do a day's worth of port installations and other things. And there was an emergency, so he had to stay. He, out of his own heart, committed a couple extra hours to do a couple more procedures because someone was dying at the other hospital.
Yeah. And you know, Kayla said it very well. The reason that our healthcare system is working to the degree that it is in the province right now is often on the backs of healthcare workers who are working short, working overtime, coming in when, you know, they maybe could or should be at a family dinner or at one of their children's events. This is something that healthcare workers have told me is contributing to burnout for them. We've lost, since Scott Moe has been the premier of this province, we've lost 21% of our rural nurses. And I've heard this from rural nurses, you know, I know that if I don't go in, if I don't answer the call to go into work on my days off, if I don't say yes to the overtime, I know that the services that my community needs aren't going to be there. You know, they describe what they call a moral injury, knowing that they're not able to provide care or, you know, constantly feeling like they have to give up their own well-being to be able to provide care to people in this province. And at a certain point, it reaches the breaking point. Again, you know, a third of our nurses retiring before 35. In the province.
I've had a lot of nurses tell me too, again, I'm around a lot, that because I've heard like, oh, nurses make so much money, they work so much overtime, they're lucky. Well, frankly, the nurses are making mistakes because they are so tired and so overworked that they usually quit, or a lot of my friends go part-time because of mentally not being able to like deal with these mistakes and stuff that they're making. They feel awful. And it's like, it's disgusting.
Well, and not only is it burning our healthcare workers out, what we see right now, an unwillingness to actually address the root causes, to address staffing in the province is actually costing Saskatchewan people more. We've got worse healthcare, but it's costing more money. Let's look at last year alone in this province. Because the government has not been effective, hasn't worked with nurses to deal with the nursing shortage. And again, this isn't a new problem. These concerns were being raised well before the pandemic. The failure to address those issues means that last year in this province, we spent, between overtime and contract nurses, as much money as it would have costed to add 1,000 full-time nursing positions. So we're spending more as a province. And Saskatchewan people are getting less. And we're burning our healthcare workers out in the process. Again, this is critical. This is an important juncture for our healthcare system. In the birthplace of Medicare, we have a system that has been brought to its knees. And again, we have a premier who will say, well, it's bad everywhere. There's some truth to that. But it is the worst here in this province, the worst number of people leaving leaving the profession, people having to go out of province, pay out of pocket to get basic care. Breast cancer is something that will face 1 in 8 women in our province. And we have women that cannot get that basic care here right now. It has to change. This is why people are looking for change. We've got a plan to hit the ground running on day one. We understand this is going to be an incredible amount of work. It's going to be hard work, but it's work and an investment worth making.
So 800 nurses over 4 years. Are you
Not exclusively nurses.
not exclusively nurses? The Sask Party has been relying quite a bit on travel nurses. Are you planning to also kind of have some reliance on travel nurses to address the problem as we hire the 800?
Yeah, I mean, we have to be, this has to be about improving the healthcare system. We have to first stabilize the healthcare staffing that we have, retain those healthcare workers that we have, and start weaning back on the reliance again of things like travel nurses or out of province services. This is about building capacity, building staffing, building the workforce that we need in the public system in this province so that people can get the care that they need here. Again, there may be for vacation relief or things like that times when you need travel nurses, but the increase cost that we've seen with the travel nurses is one that, frankly, as I said, is costing us more, and Saskatchewan people are getting less. We need to work with the existing healthcare workers. We need to listen to those in the profession. We need to have a plan, really an all of the above approach to retain, attract, train healthcare workers to this province again so that people can get the care that they need and they don't have to at one of the worst times in their life. Be in a hotel room thousands of miles away from loved ones, getting the worst diagnosis, and having to pay out of pocket for it on top of it all.
I'm just wondering, are you planning to hire more than the 800? Because I think Scott Moe's plan was like 1,400. Over the past years of recent nursing grads, he said he's hired. So are you planning to do more than the 800, or just trying to see if it's on top of anything?
What I have is a plan that will actually ensure, not talking points, not this waving around of his 4-point plan, retaining the healthcare workers so that we have, again, having the number of people that we have leaving the profession, that's 2,000 right there, and hiring an additional 800. That's the commitment, and again, I don't make promises that I can't keep, but we will continue to work to ensure that we have the staff that are needed in this province, in the places that they're needed, and that it keeps pace with population changes and population growth. This can't be about serving, self-interested lines for politicians to wave around. This has to be about fixing our healthcare system and ensuring that we have the healthcare workers in the system that can deliver the care that Saskatchewan people need.
Kayla, when was it that you were told that you wouldn't be able to get a biopsy till February?
In June.
Do you have a number for how many vacant spots there are specifically in the Regina hospitals, like was mentioned in your release?
In the Regina hospitals alone, I believe that there are, I don't have the Regina numbers, but there are 1,500 vacant healthcare positions right now in the province that we know of. Half of those are listed as part-time or casual jobs. And again, that's another piece of the solution here, is to convert those positions offered away from part-time and casual and actually offer full-time positions. It's hard to get people to come to move to take a part-time position, right? And this is something we've heard from healthcare workers themselves, that this is one of the changes that's needed.
Scott will announce today just the carbon tax, not paying that in 2025. Would that be something you would commit to as well?
Look, the first thing I'll say is I don't support the carbon tax. I don't support the fuel tax. I also don't support adding PST to things like kids' clothing and to groceries. We've got a plan to remove 3 of those. One of them starting day 1, the other 2 by Christmas. On the carbon tax, it would be my commitment to get a deal. Remember when this carve-out happened, we saw a Liberal minister, basically acknowledge that this was politically motivated. Heating homes, of course, in this province is not, or any province in Canada is not a luxury. We have to do that. This carve-out has been unfair, and should not have happened in the first place.
And then the Sask Party today, they had a news release about their candidate for Esteban Big Money. He just had some song lyrics that were misogynistic and supported using drugs. I'm just wondering if you're aware of that and what you think about that.
I wasn't aware of that. I will, song lyrics are one thing. Getting caught up in a sex trafficking sting or, having assault charges for choking and assault, those are another thing. I don't know. We have critical healthcare services that are not available in the second largest city in the province. We have an emergency room in Saskatoon that's 3 times over capacity. We have more healthcare workers leaving the province than any other province. We have people who aren't getting the care that they need. I think it's about time we had a government that actually focused on the things that matter to Saskatchewan people and had a plan to fix it. Song lyrics, I don't know.
For sure. And just another one for me. The legislation around pronouns and parental rights, what's the plan there if you do form government? I haven't seen anything yet on your platform about that.
Well, we literally have T-shirts that say, repeal Bill 137. Again, I support parents being involved in their kids' classrooms, in their kids' education. In fact, the ability for kids to have their caregivers and their teachers working together to ensure that they have the best education, that's incredibly important. There are a lot of issues in education that need fixing. Let's remember why that was brought in the first place. That was another attempt by this government, by Scott Moe and the Sask Party, to divide and distract rather than actually deal with the issues that were in front of them. This is why people are looking for change. This is about more than talking points for politicians. There are very critical things that are at stake here. We have his platform that doesn't look at investing at all additional dollars for healthcare and education. 2 systems that have been brought to their knees by underfunding and neglect by this government. Let's focus on the things that matter to Saskatchewan people. People are so tired of this stuff. People want, as I've been told, just have their leaders act like grown-ups and actually try to fix things, not just try to distract and divide. People are tired of it. I'm tired of it.
Just a couple more off-topic questions for my colleague in Saskatoon. Do you roughly have a number of how many Indigenous candidates are running for the NDP?
I'm sure that's something we can get to you. I don't have the percentage or anything off the top of my head.
Okay. Why would you say it's important to have Indigenous representation in the provincial legislature?
I think representation is important. I think it's important that we have perspectives from all people in this province in the legislature, and Indigenous representation has not been fully there in the legislature. It brings, you know, when people are elected to sit in the legislature, they bring their lived experience. They bring their worldview, their concerns to the legislature, and you know this is First Nations and Métis people in this province. They've not had that type of representation in the legislature in numbers that are equal to the proportion of the population. So I mean, I think that is always important to have not only the representation, but bringing different perspectives to the table. To it impacts the decisions that are being made. It impacts the things that we talk about. I'm going to use the example of women, for example, the lack of voices of women in the legislature. 1 in 8 women facing breast cancer. I don't know that it's coincidence that we see the state of women's health in this province when we see a lack of representation by women in the current government. It's representation is very important.
How will you and the NDP assure that Indigenous voices will be heard in the legislation?
Well, I mean, I think we've seen that already with our caucus. I think of 2 of my colleagues, Doyle Vermette, who repeatedly over the course of his service to the people of Cumberland, but the people of Saskatchewan, brought forth those concerns. I think of his private members bill to address rising suicide rates across the province, but particularly in the north. That voice was powerful. I think of my colleague Betty Nippy Albright, who has not only brought her voice, but brought the voices of communities and leaders right across the province to the legislature. I think her duty to consult bill, for example. These are not these are important and valuable voices that bring that perspective to the legislature. I think the other thing is, and this goes at the heart of many of the concerns that we see with the current government. When you seek to form government, you don't just lead for yourself and your own self-interest. You have to be willing to work with other leaders, First Nations and Métis leaders, for example, work in the interests of all people in the province, and be willing to work with them. Like we're talking about healthcare today, the lack of a willingness to listen to healthcare workers, to listen to those on the front line, has meant that we see many of the problems that we see in the province right now. And I think this is why a lot of people are saying we need not only a change in government, we need a change in the way that decisions are made in the province, that they're being made in the interests of not just a few, or not just not just the government's own political interests, but actually decisions being made to improve the living conditions, the economy, the opportunity for all people in this province. And that's exactly what we're putting forward.
You've said that the Sask NDP doesn't support the carbon tax, and Mo again today has said that the Sask NDP is supporting the carbon tax. What do you make of those repeated calls by Mo saying that the Sask NDP supports the carbon tax, despite you saying that you don't?
Yeah, as I said, I'm perfectly capable of speaking for myself. I have consistently. I ran for the leadership saying just that, and have never backed away from that position. Mr. Moe will have to say why he continues to lie. I would expect it's because of his own political self-interest. I've been very clear that I don't support the carbon tax. I've also been very clear that I do think that we need to reduce emissions. Mr. Moe has said he doesn't care on that. This is increasingly a government that lies, misrepresents what other people have said, looks to divide and distract, because, frankly, his record isn't one that I'd want to be running on either. Mr. Moe has said he wants to run on his record. What I see him is running away from his record to, I see him resorting to desperate lies, verifiable lies. These are things that I've not just said recently. I've not just said one or two times. I'm on the record many times in the legislature putting our position forward that we do not support the carbon tax. I guess Mr. Moe should answer for why he continues to lie about that.
Just so I'm clear on what you're saying, you would work with the federal government to get a deal around the carbon tax and the carve-out, but you would not continue to take the...
Just on the carve-out. Mr. Moe made a lot of noise about the carve-out. The reality is that he didn't get a carve-out for home heating for this province, or we didn't see any expansion of that carve-out. We don't support the carbon tax. We think we need a different model. Right now, the carbon tax sees people in this province with increased costs, and we're actually not reducing emissions. That's been our position all along. On the home heating carve-out, yes, it has been removed from power bills. Something that I think, when we see other provinces with the carve-out, I think it's just a measure of fairness. As I said at the time, it's why we put the motion forward in the first place. This was obviously a politically motivated decision by the Liberals, and that was confirmed by Minister Hutchings. But we've also seen, Scott Moe remit half of what was owed on the home heating charge to the government of Canada. We need a rework. We need a different system that doesn't have a consumer-based carbon tax. But again, this is something that Mr. Moe misrepresents time and time again. He misrepresents our position, but we haven't seen him, get a better deal with the federal government. That's our commitment, regardless of who's in power, to always put the interests of Saskatchewan people first. Mr. Moe likes to make a lot of noise, but he doesn't have the same record when it comes to actually delivering.
So we can keep the carbon tax off the home heating bills until you negotiated something with the federal government, as Mr. Moe said?
Yeah, we'd be prepared to do that, understanding, that there's still a portion that is being remitted to the federal government right now.
We have time just for one more here.
Just kind of along the same lines as the Phil Smith questions, there were some things that came out last week reporting that Melissa Patterson, your candidate in Moose Jaw, had publicly liked pornography on social media. Is there anything you want to say about that?
No, again, I've been very clear about the things that we're focused on in this election. The things that I think matter to Saskatchewan people. Again, we've got a healthcare system that's on its knees. We've got 1 in 6 people that can't find a family doctor. We have people who are leaving the province, paying out of pocket to get basic care, life-saving care that currently isn't available in our province. As Kayla said, had she waited to get care in the province, she might not be here with us to actually get that care. We've got kids who've had a decade of underfunding in their classroom. We've got people that are worried about paying their bills. We've got rising crime rates. We've got the highest violent crime rates in the country, and you know, double the national average. And this is the crap that Mr. Moe is, you know, that the Premier is focused on. There's no wonder that people are frustrated. They're looking for change. Like, I can't imagine what that feels like to hear that this is the focus of a government that's been in power for 17 years. This is the stuff that they're focusing on. It's incredibly frustrating. I think Saskatchewan people deserve better, and it's no wonder that people are looking for change. You know, yeah, I think that's all I want to say
Will
on
the
that.
candidacy of the Estevan and Moose Jaw candidate be reviewed, or are they firmly in place in your mind?
You know, I'm just gonna hit the
Maybe you don't know what the comments were. so
yeah.
just-
Well, I mean, you know, when I look at what is facing people in this province, when I look at the things that people care about, that the people want, not just Scott Moe and I, but all leaders in this province to be focused on. I'm not sure that it's, you know, things that happen on social media or song lyrics. It's probably that they want to be able to get a doctor, that they don't see their loved ones die on a wait list before they get health care. You know, maybe being able to pay their bills and put some presents under the tree for the kids, or put gas in their tank to get to school. I mean, if that's what he wants to focus on, he can fill his boots. But we're focused on the things that Saskatchewan people need. We're focused on the things that we can deliver for Saskatchewan people, and putting that plan forward to be able to hit the ground running on day one if we are given the privilege of forming government after October the 28th. Scott Moe can focus on that. We're going to focus on the people of this province and delivering better, because we know people in this province deserve better than what they've got right now.
Okay, thank you, Carla, thank you, Kayla.